All right, it's great to see everyone still here and awake. I think we had some excellent talks tonight, so hopefully mine will give a different perspective. I don't have any financial interest in talking about how I learn things. What's the advance next? All right, so how do you get from A to B? That's what we're talking about. You're somewhere in your ability and you want to progress forward and you want to move somewhere further. And so I think you need to identify the question or receive inspiration. And you can do that yourself, watching your own videos, being critical, your own self-critical review, getting feedback from other doctors in your practice, or referring doctors, or even patients. I think those are valuable things. And really this is set against the background of not being willing to accept the status quo and having a willingness to accept some level of risk. Stepping outside of your bounds of what you do normally always feels uncomfortable, so just get comfortable being uncomfortable sometimes. Research the technique, the devices, the methods. There's a ton of different ways. People showed those earlier. The amount of material that's online now is incredible. YouTube was only here starting in 2004, and it was very, very small early on, but I do remember actually when it started in my practice and in my life, and it's really changed a lot of things. But there's a whole host of other resources, and people have talked about those already. And then I like to take baby steps. Identify ideal candidates for the procedure or device or whatever you're looking to do or change. Maybe take some simulated steps early on, as other people have talked about. You can do wet labs as well, but you can actually just do parts of the procedure depending upon what the procedure is that you want to incorporate. Then review your cases and be critical about that, be consistent about it. Do video like Ike was talking about. Video for every surgery is something that I believe very strongly is really important. I still review all my own videos every day, and it's kind of like a decompression. And then enhance and integrate that whole process. So now you've done some baby steps, now you're going to move forward and actually figure out how you're going to make that better. And you do that by critical review and analysis of your own cases, as well as the outcomes, both short and long term in your own patients. And then just start repeating those last two steps. Keep on reviewing, enhancing, and integrating, and always looking for your next opportunity. And some things will actually just come up for you. I am a big believer in cleaning the capsular bag, and here's me curetting LECs. And this is a case I did a few years ago. This bag looks really clean. I was very happy with the result at the time of surgery. And I'm thinking, well, that's pretty good. And actually, focus isn't too bad either, isn't it?
It's really
so this patient actually had a good result, but 18 months later, they felt intolerant of the nighttime halos. And look at the fibrosis I have in this bag. Didn't I clean this out? Yeah, I did. I actually had that video, by the way. And so I'm able to actually extricate this bag, but there's a ton of fibrosis despite my efforts of cleaning this bag early on. And I'm just wondering I obviously left something there. Let's look at this Summerings ring that we're going to have here as well. Successful outcome, but still wasn't very happy. And that was what inspired me to do this. The subincisional was always the area of concern. And so I started to irrigate once I had the lens in, viscoelastic out. But I also had some problems with this. I get material hung up on the IOL, and once I liberated it, now I couldn't stand leaving it there. Many steps later and evolutions of this process, I now trim viscoelastic, make sure I have a pathway for fluid to escape from the anterior chamber. And the next step is to take a 27 gauge cannula with 5 cc syringe and just irrigate into the fornix of the bag. And some areas are going to be not very fruitful, but other areas, it's shocking how much material comes out. And this is an experience that I've seen over and over again. I never would have gotten that out with a curette. And that would have actually just gone on to Summerings ring later on. I've gone to figuring out, well, I can't get everywhere very easily with a regular 27 gauge. What else could I use? And here's a chain cannula being applied. And look at all this subincisional material. It's amazing how much I was leaving in the eye and in the capsular bag. So this actually, to me, leads to a quieter eye. It has less fibrosis, less inflammation, and does preserve the ability to approach that eye later on if I want to exchange that lens. So what did we get? Well, here's an eye that's 9 months post-op. Now, this is an eye that I did do that lavage technique. That's what I call this. But this is Helon dissection of the capsular bag. It's incredibly easy, but you still have capsular fixation. It's not denuded of LECs, so that lens isn't moving around inside that capsular bag and it cause some problems, but it's very easy to approach. And this is something I think any of us can do. But it kind of taught me a process of thinking about this sort of technique that I've incorporated. And I've used this sort of iterative process for many different things in my practice. Capsulorhexis, hydrodissection, this lavage, posterior capsulorhexis, intrascleral haptic fixation, iris suturing, just a few that I could just think of and throw up. But it actually applies pretty much to any technique that I want to evolve and get better. And I think really the key elements are you have to have video. You need to be critical of your own abilities and techniques. You need to have the desire to improve and not just stay with the status quo. And then research your techniques and your devices, having maybe peer-to-peer discussions, whether it's online or in person. These sorts of meetings are fantastic for this. And then a willingness to accept some risk. It is uncomfortable sometimes to do something new. You're uncertain whether it's really going to work well, but you have to actually just be observant and actually modify what you do, and it actually evolves into something that's very approachable and very reproducible. So that's my technique. That's how I think about this, and I appreciate your attention. Thank you.